Hello everyone and welcome to my channel. Today I'm going to talk about epulis and giant cells. First, part one will be about epulis and giant cell will be part two. So epulis, so it's basically in Latin, it means benign on gingiva. So a rise of something benign on the gingiva, okay? We're going to go through the classification and we're going to go through each one of them. So here's the classification, okay? So the first one we have Epulis congentina, Epulis osteofibromatosa, gravidarum, Gigantocellularis, fissuratum, Hemangiomatosa, and granulomatosa. Just briefly, I'm just gonna say, I'm gonna write it down here so you can have it as a side note before we go into details. So congentina is in infants. Okay, it arises in infants and kids. Fibromatosa is because of trauma. I'll say what kind of trauma, not like getting hit in the face. Gravidarum is in pregnancy. Okay. And also this one, it arises from blood vessels. This one is basically after extraction. I left these two because this one, okay, it's basically because of ill-fitted dentures, let's say. But I mean, all of these could have their own reasons, but this is just like a brief explanation of what they are. So when we get into details, you guys could just have it as a side note, let's say. Okay. So okay, yeah, we have Gigantocellular that is left. This one is also like let's say irritation again or trauma. I'll just say irritation. Irritation. This is also irritation to this one, fibromatosa. But anyway, okay, so that's the small summary. Now let's get into details. So about congentina. So congentina is here. So it's also known as congenital epulis. Okay, I mean it has different names. It's usually in the newborns. It is a rare benign tumor that occurs in the oral cavity of newborn infants. It is characterized by a localized overgrowth of cells that originate from the gingival mucosa, which is the gum tissue. Correct? Like as we can see in this photo. And treatment is just surgical excision. They just take this out and that's it. Okay, that's about that. Now, number two, which was Epulis osteofibromatosa. So it's a non-cancerous oral lesion that originates from the gum tissue. Okay, as we said, epulis in Latin means benign on the gingiva. So all of this are going to be just on the gingiva. Okay. So this one, it looks like a firm pink red mass near the gum line, as you can see here, here, and also here in the picture. Okay. As I said, the exact cause is unclear, but they could say it's related to chronic irritation or inflammation. Okay. And the treatment involves the surgical removal, and the recurrence can be minimized by addressing the underlying factors. For example, if the patient has poor oral hygiene, or if they're wearing, like for example here, it's obvious that they're wearing a denture, that it's probably not fitted well, or it's not, or it's irritating somehow the gums. So that's why they need to, after the extraction, they need to change their denture, and usually it will not reoccur if the underlying cause is fixed. Okay, and then we have number three, which is Epulis gravidarum, which is in pregnant women. And yeah, it usually occurs in the pregnancy, as you can see. It's this lesion here, and usually it can happen in the second or third trimester. It's because of the hormonal changes, the ups and downs of different types of hormones in pregnancy. This usually can occur, and usually they just do the surgical removal, and they say that it regresses after the delivery, the lesion. And yeah, so as you can see here in the pictures. Okay. And then we have Gigantocellularis, as we said. It's a rare benign gum tumor that appears on a large pink mass, okay? The gum. Yeah, it typically affects the adult and is caused by chronic irritation or trauma, okay? As you can see in the photo. And usually they just extract it and that's it, and just regular follow-up. Then we have Epulis fissuratum. This one is a gum overgrowth caused by ill-fitting dentures. It's kind of like the osteofibromatosa that we talked about it here, but this is a bit different because it's like this is like an overgrowth. It's not like a lesion. See, this is overgrowth, and this one is mainly just caused by ill-fitting dentures. And the treatment involves adjusting or replacing the denture and removing the excess gum tissue. Okay, so they just remove it and then just change the denture. And then we have hemangiomatosa. This one, they're actually they're common benign tumors that arise from the blood vessels. They appear as raised red or purplish lesions on the skin of mucosa. So they're actually common in infants and young children, but usually they just resolve on their own without any treatment. But if they're big and they're causing some problems, we can, they require medication or laser therapy or surgical. And last but not least, it's Epulis granulomatosa. It's basically because of post-extraction. So here you can see this is like a red lesion, and the white spots on top could be because of the trauma afterwards. But yeah, usually these also just surgically are removed, and that's it. But yeah, and that's it for Epulis.